Are you experiencing an annoying radiating pain from your lower back to your hip, to your buttocks, to your leg, and all the way, sometimes all the way to your foot? If this is happening to you or somebody you know, then you need to watch this video. Maayong adlaw na tong tanan. I'm Nathan, I'm your occupational therapist, and my goal is to help you be more consistent with your therapy at home. The pain that you're experiencing from your lower back to your hip, buttocks, leg, thigh, and all the way, sometimes all the way to your foot, is what you call sciatica pain. Sciatica or sciatica pain is caused by the narrowing of the space or the canal where the nerves from your spine is coming out. And this is located at your lower back. Now this is because of a few things. Sometimes it is a fracture or a degenerative disc disease, arthritis, bone spurs or fractures, and sometimes an injury. And the number one cause for this narrowing of the canal or the disc is bad posture, whether you are just static or dynamic, like you are doing something and you have that sudden injury or fracture because of lifting a heavy object and not observing a proper body mechanic, or you are always on your computer hunched over, and that develops over time. So you will mostly see this as you age, so around 30, sometimes even 20 above. Now there are about 40% of the population will experience sciatica pain sometime in their life. So the best way to prevent sciatica pain from happening is having good posture, whether you're standing or you're sitting down. I had this pain, it is very debilitating. I wasn't able to work at all for about 2 days. And so I had to see my therapist. Of course, us therapists would also consult other therapists or even other people who are specialized with sciatica pain. So don't worry, I'm going to share you all those techniques in this video. So stick around and follow along with me. So yes, I had a first-hand experience on how frustrating, annoying, and debilitating this sciatica pain is. It ran from my lower back and all the way to my lower leg. So luckily I didn't have any pain on my foot. So I had to talk to my therapist and ask him how to treat my sciatica pain. And the first thing he told me was to fix my posture. He observed that my posture is a little bit rounded like this, and I've always been doing that. He have observed that before. And so he told me to try to fix my shoulder, bring my shoulder back, and then try to imagine that a string is pulling me up. Just like what your mom would tell you when you were young, or if you had any modeling gig, they always tell you to imagine yourself that a string is pulling you up. Now the next thing that he asked me is where I put my wallet, or some of you would call them billfold. He asked me where I put my billfold or my wallet. So I told him it's always in my back. He told me, yeah, that could be one of the problem, because when you have your billfold or your wallet to your back, like most guys, your hip is not aligned. One side of your hip is lifted or hiked up. So he told me to put the wallet in my front pocket, or in a pocket in my shirt or my jacket. So that's one of the things that I have also changed. And another thing too, he gave me this advice when I'm going to sit down. He told me to stick my butt out first, just like that, before sitting down. Trying to find that chair is very important. So again, he told me to stick my butt out first and lean forward, sit down. This will stack your spine on top of the other, and it will maintain the natural curvature of your spine, which will not impinge the nerves that is causing your sciatica pain. So try to stick your butt out first before sitting down. Try this experiment. Just sit down naturally like you always do. Your lower back will be rounded a little bit. Now try to stick your butt out first and sit down. See how it feels. You feel more aligned, you feel more upright when you do this. Even getting in and out the car. When you're about to sit down, stick your butt out first, sit down, and then bring your legs in. You will see a big difference. Another thing that he also reminded me to do is to observe proper body mechanics when trying to lift up heavy objects. Say for example, this bag. When you lift it or you're trying to pick it up from the floor, you have to bend your knees and hips and then bring it close to your body when you are going to pick it up. Now when you have to put it down, please do not rotate immediately, and that will cause a big trouble to your lower back. Big pain. You will not see this immediately. Sometimes you do because it has a compound effect. Your behavior will affect your spine, and eventually the spine will give in. Now for us therapists, we have to pick up patients, help them get up from sitting. So we tend to do a lot of lifting right now. If we don't observe proper body mechanics and proper posture when we lift objects from the floor or helping a patient get up, we will have bad backs. Now, that is the problem that I have. So aside from having bad posture standing up, I also had bad body mechanics when I'm trying to help people get up from sitting down. Now that you know how to prevent sciatica from happening again, or how to not get sciatica pain, let's do a few exercises to relieve you from that devastating effect of your sciatica pain. So the first exercise is what you can do sitting down. The first exercise to prevent, or rather to relieve of your sciatica pain, is just a nerve glide. So there's an easy way to remember this. So it is up, up, and down, down. So look up and bring your leg up. So for example, if my sciatica pain is on my right side, I'm going to pick up my leg and look up. So up, up, and then down, down. Slow, and look up, leg up, and down, down. So foot down, look down. Look up, foot up. All right, so that's the first exercise. Try to do 10 to 15 repetitions 3 times a day. So aside from nerve gliding to relieve your sciatica pain, you can also make use of a wall. So in this example again, my sciatica pain will be my right side. So let's just be consistent, right? So my sciatica pain is on my right side. So I'm going to lean against the wall. My hand will be on the wall like that, about a foot away from the wall, and you're just going to lean towards the wall. So you're going to bring your hip closer to the wall, just like that. This will open up the spine or the vertebrae from that side. It will open up sideways like this, right? So hand against the wall and try to bring your hip towards the wall, all right? Do this about 15 times, but very slow, all right? Just make sure that you have good balance. That's why I like this exercise, is because you are leaning against something that is stable, right? So just do about 10 to 15 of this wall leaning, just like that. Now the other exercise, you are going to just try to bring your hands to your hips rather, all right? And then put the heel in front of you, the side of your body that has the sciatica pain. So again, my sciatica pain is on my right side. I'm going to bring my heel in front, and I'm going to just lean away from it, just like this. All right, very slow. Now you can do the other side too if your sciatica pain is not too bad. But if it's really bad, just go lean away from the sciatica pain when you do this. Now, if you are sitting down, or you can also do this standing up. You can also just put your hands together, but it's better if your sciatica pain is on the right side. Your right hand will hold on to your left hand. You're just going to lean away, sideways. and hold that for about 15 to 30 seconds. Then slowly come up. Sitting down or standing up, this should relieve you of your sciatica pain. Alright? So just be consistent with these exercises and stretches. These have relieved me of my sciatica pain in just about 2 to 3 weeks of being consistent doing these. Alright, so that was a very short video. So if you want to remember those exercises, just replay this video and follow along with me. If you need to pause that video, just pause it and do those exercises. Just remember to consistently do this 3 times a day, and rest assured, if not pain is gone, at least it is lesser in about 3 weeks. So being consistent. Now, if you know somebody who has a lot of back pain and one-sided pain that runs from the lower back all the way to the foot, please share this video to them. Who knows, you will be the key to helping them out. And if you have any questions, suggestions, or comments, type it down below in the comment section. Oh, I forgot to do the attendance check. So if you have been here, I've been doing attendance check. Type down below in the comment section, electrifying. Again, the word is electrifying. That is sometimes how you feel there in your knee, on your leg when you have sciatica pain. And just a reminder, consistency is the key and never give up. Until next time. Paalam! Zoom!